It's Friday. It's Friday. It's Multiple Sclerosis Month. Multiple Sclerosis Awareness Month. Not to celebrate multiple sclerosis, but to tell you about multiple sclerosis. So in this video, I'm going to have some people tell you about multiple sclerosis. So like, comment, and subscribe. Like, comment, and subscribe. After 5 years of being diagnosed with multiple sclerosis, 15 years of having multiple sclerosis, I just didn't know what it was. But I know I had it for 15 years after I was diagnosed 5 years ago. So I still don't know all about multiple sclerosis. But I'm going to give you a little bit of information about multiple sclerosis on this video. From the people in this video. So don't forget to like, comment, and if you're new, subscribe.
I'm going to kind of freestyle this whole message. For a long time, I've known what multiple sclerosis was, but I didn't really know what happened when people had it. I was aware it was an issue with the brain, and that was about as far as my knowledge went. Now, it wasn't until I had met somebody with MS that I really knew what it was and what it does to people. And then, of course, now you're seeing the news about celebrities like Christina Applegate that has it. While March is International Women's Month and they have the International Women's Day, March is also the Multiple Sclerosis Awareness Month. And the big issue is it's not getting enough awareness. The pharmaceutical companies love this disease because they make a ton of money off of it. And state by state, they decline people for disability with this disease because, well, it doesn't help their posters, it doesn't help their campaigning. Because people that have MS, you can't really see that they have MS. It's just not a visible thing. To give you a quick synopsis of what it is MS is a disease in the brain, and what it does is it disrupts the communication between your brain and your central nervous system and the rest of your body. People will find themselves going paralyzed and losing function in things, going blind and deaf, and have days where they can't walk if they didn't go paralyzed, and they have monthly flare-ups, and the cost to maintain it is astronomical. If you have insurance and you get what's called an infusion every 6 months, which is injected into you, even with insurance, you're still going to pay nearly $10,000 out of it. So much like many other diseases in this country, people are killing themselves with stress and anxiety to help pay for these things. People are literally dying just to live, and it makes no sense. This country's healthcare is already shit, and it's already terrible, and it's run by greedy corporate mongers that just want to make the huge bucks off of people suffering. Disease and suffering for everybody in this country is a humongous profit. It's a great bank for them. But with this month, it's supposed to be the MS Awareness Month, and there's minimal awareness being done. The government's not doing anything to help spread awareness about this. Health facilities aren't doing enough to help spread awareness about this. And it's something that takes life away from people, and it's something that they're not doing enough to try and find a cure for. Please share this video. Please reach out to people who might have it. People who do have MS, you are warriors. Get online, make a video, and spread your story. Get online and start talking to people about it. Help people understand what it is and how serious it is. So thank you for watching this video. Please feel free to reach out. I am not the know everything on it, but I have great resources, and asking questions is a great way to get it out there. So thank you guys.
Multiple sclerosis, or MS, is a potentially very disabling disease many people suffer from, but not many people really understand. Let's change that. First of all, what is multiple sclerosis? Multiple sclerosis, or MS, is a disease of the brain and the spinal cord central nervous system. In multiple sclerosis, the protective cover of the nerve cells are attacked by the body's own immune system. This creates a potential communication problem between the brain and the bodies and the spinal cord. Eventually, the disease can cause permanent damage and deterioration of the nerves. What are the signs and symptoms of MS? The signs and symptoms will vary widely depending on the amount of nerve damage and also which nerves are affected. Some people with severe MS may even lose the ability to walk or move independently at all, while others will experience long period of remissions with no symptoms at all. Some of the more common symptoms of MS include numbness or weakness in one side of the body, affecting mostly your trunk and your lower limbs. Electric shock sensation that occurs with certain neck movement, especially when bending the neck forward. This is known as limitus sign. And tremor with lack of coordination and lack of a steady gait. Furthermore, symptoms can often affect vision, causing loss of vision often in one eye at a time, and pain with eye movement, and periods of prolonged double vision, and also blurry vision. In addition to these symptoms, MS can also cause slurred speech, fatigue, dizziness, tingling pain in parts of your body, and problems with sexual and bowel movement. The course of the disease will vary. Most people with MS will have relapsing and remittent disease courses, where they can experience new symptoms over days and weeks, and other periods be completely free of symptoms for months. However, at least 50% of people with MS eventually develop a steady progression of their symptoms, with or without periods of remission. This is known as secondary progressive MS. What causes MS? The real cause of MS is unknown. It's known as an autoimmune disease, in which the body's own immune system will attack the body's own tissues. In the case of MS, this immune system attacks the fatty substance around the nerve cell. This is the substance which protects the fibers of the nerve, especially in the brain and the spinal cord. The risk factors for developing MS: anyone can develop MS, but it's usually more often occurring between the age of 20 to 40. Women are more likely than men with a twice disease rate. Family history, with people who have siblings or parents suffering MS being at a higher risk. Certain infections such as Epstein-Barr virus, and race. White people, especially those from Northern America and Europe, are at a higher risk of developing multiple sclerosis. In addition, vitamin D deficiency have been shown to be linked to increased risk of MS and other certain autoimmune diseases. And finally, smokers. How to diagnose MS? There is no specific lab test for multiple sclerosis. Instead, the diagnosis depends on ruling out other diagnoses that might produce similar signs and symptoms. This is known as differential diagnosis. In addition, some blood tests and spinal cord fluid examination are done, and magnetic resonance imaging, which can reveal MS lesions on your brain and your spinal cord. Treatment for MS. Sadly, there is no treatment for multiple sclerosis. Treatment typically focuses on speeding recovery from the attack, slowing the progression of the disease, and managing the symptoms. Some people with very mild symptoms require no treatment. The medicinal treatments used for multiple sclerosis include corticosteroids such as oral prednisolone and intravenous methylprednisolone, and these are prescribed to reduce the nerve inflammation which occurs during the disease. Sometimes plasma exchange, known as plasmapheresis, is removed from your body, mixed in with a certain albumin, and returned to your body again. This has been used to treat symptoms and is useful for patients who don't respond to steroid therapy.
Be the best you can be. Love your family, love your friends. Spread love, not violence, not this virus. As always, peace.